A warm welcome to the Evolution Show. I'm Johan Landgren. I hope you're great. In the previous episode, I shared some of my experience with stem cell therapy, using what's called mesenchymal stem cells. And I talked with Josh Ketner, the founder of Dream Body Clinic, one of the world leaders in stem cell therapy. And we covered how they work and how stem cells can help many people heal, prevent and recover from things like heart failure and artirithis in knees and much more. And today I talk with Josh about some of the cutting-edge stem cell therapies they are working on at the Dream Body Clinic in Mexico, and some of the future stem cell treatments that may change preventive medicine as well as healing completely. And if you missed part 1 of my talk with Josh, I highly recommend you start with that. Check out the link below and above. Before we get going, if you liked the episode, don't forget a thumbs up and consider subscribing to support the show. And take a look at my new Patreon page where you get exclusive access to the technical details and thinking behind my new energy house that is quite unique, that I've designed with my father. And it's now under construction. Check it out. Okay, let's get going. This is the Evolution Show. Welcome back, Josh Ketner.
Hello.
Hello, yeah. You're the founder of Dream Body Clinic, a pioneer in stem cell therapy, and you're in Mexico. Yeah, and in our previous conversation, we looked at, an overview of stem cells, what they do and what you're doing at Dream Body Clinic, and I encourage people to check that out. Today we're going to, look into the future and look at what you're doing, look how you're improving different stem cell therapies and how you see the future going for stem cells, because it's an exciting area and I think people should get into this more. And so let's get into it. Where do you see the biggest short-term potential for mesenchymal stem cells for new treatments of disease or injuries, for example, that is not developed or in early stages right now?
I mean, there's a lot going on. There's, like we talked about previously, look, an MSC is an MSC is an MSC, right? So they all work the same way, they do that. They've tried different things. They've tried like exosomes, which are the signals that are sent out by stem cells. But those aren't smart. Stem cells are smart. They will send the correct exosomes to the right place. That's why we don't do exosomes by themselves. I think eventually that could get to a point where it would be very viable. Like we had been to a conference with Dr. Kaplan and Dr. Correa in the past, and they were kind of, arguing both sides. Kaplan said, why go with exosomes when we have the delivery device? Correa was investigating exosomes because there's over 1,000 different types of exosomes, and each one has a single payload, say a cytokine, a chemokine, a trophic factor, different things like that. And some cause inflammation, some guide healing, some help the immune system. There's a lot of things. They're so small, we don't even know what they all do yet. Haven't even named them all yet. Haven't even found a way to isolate them. It's very rudimentary first stage of this kind of science. So once we eventually know what they all do, well, maybe you could culture just a specific type of exosome, have it released and bottle that for, say, just cartilage repair. So that could be a possibility. That's one direction. That's a possibility for what could get approved in, say, Europe or United States. So as far as big pharma goes, I think that's the direction. I think it's pointless. I think you're better just to do stem cells, do larger numbers. It's already available. The other way we're going is it's more minor differences. I don't think you're going to see some major revolutionary breakthrough, at least with mesenchymal stem cells. We're starting to find different tissues maybe have a little bit more adherence to, say, nerve damage, or other parts of the placenta or something will be better for, let's say, cartilage repair. We're finding out little differences. I mean, not enough to make a huge difference, but maybe we could increase success rates a little bit. That's more of where the future is going with mesenchymal stem cells. The other one they're looking into are what are called induced pluripotent stem cells, because embryonic stem cells were all the rage early 2000s. George Bush, when he was president, got all this flack for banning it, but he didn't really ban it. He simply said, look, my advisors said this won't work and federal government won't fund it. Well, it turns out he was right. State of California still spent $2 billion researching it. Didn't work because these things, they're from aborted fetuses, so there's a big ethical concern too, and they usually will turn into teratomas, a type of tumor. They want to become a baby. So then came this doctor, is it Dr. Yakanoma or Yakamoto? I'm sorry, I get his name wrong, but at USF, San Francisco, in Kyoto, he developed ISPCs, induced pluripotent stem cells, and these they could take skin tissue and turn into certain things. So far they've done, I think, one procedure turning them into heart cells, and they'll proceed with that. Again, this is another good thing for pharmaceutical companies. They can patent, it's worth investing the money. Mesenchymal stem cells you can't patent, so they'll never really become possible because no one's going to spend the $1 billion to get them through FDA approval. So the only real advances you're going to see in stem cells are going to be more in those categories where it can become regulated and distributed more like a pharmaceutical drug. But as we, at least my belief, I don't think they really want to fix anything. They'd rather give you a pill for a pill for a pill. So I don't really see, it's a bleak outlook, but I don't see, at least on mainstream medicine, anything major changing that's going to go fix some of these issues, because I just don't really believe that's what they want. They want something that maybe it can help it for a while or treat the symptoms, but I don't think they're looking to completely fix your bad knees. Maybe I'm jaded, but that's my thinking.
No, I completely agree. I can just mention recently in Sweden, at the Lund University in south of Sweden, they are actually using embryonic stem cells for Parkinson, Parkinson research. They started with 3 patients, I think, and they have promising results with that. But as you mentioned, I'm very skeptical about embryonic stem cells in general, just because of the risks associated with them. If they can work around that, sure, but there is only, if I understand it, there's always a risk that one tiny, little piece that wasn't supposed to, join it into the body becomes a tumor, So there's always that risk, and you don't have that risk with mesenchymal stem cells, which I think is, the biggest advantage in terms of safety.
It gets tricky because, maybe it's just human hubris and thinking we can create something better, but we've got these amazing things already in our body that can heal. We aren't taking advantage of everything. So I think it'll be more along those lines. There is one treatment available in the US where they'll culture this, because the stem cells are multipotent. They can turn into a few cells, like chondrocytes, for example, are the building blocks of cartilage. So I think there's one treatment where they can differentiate them from your own fat stem cells into chondrocytes, put them in this gel, put them in your knee, and it can help. They're having okay results with it, but it costs $40,000 and pretty much no insurance will cover it. There's a couple clinics out there trying to say that they're using cells like ours and doing chondrocytes. That's not possible, because once you turn an MSC into a chondrocyte, an adipocyte, a osteophyte, they will exhibit the HLA of the donor. So you can't use umbilical cord cells for those types of treatments, it becomes a numbers game again. So if you're taking it from yourself, you're probably not getting enough to even make enough chondrocytes to make a big difference. So again, I keep coming back to MSCs. I think it's just we got to keep working on making the MSCs more viable, more functional, more specific, which that I do think is possible, and it should get better and better. New techniques, they're using different biogels and things in the culturing process. Even in the culturing process, the culturing medium that we grow it in, we're finding different things. Like we had added metformin, which is a common diabetic drug, to it cultures for a while for diabetic patients, and we were seeing even better results. There's been studies with CBD oils. Cannabinoids have a great effect on nerve regeneration, so it seems maybe you can add some cannabinoids to the culturing medium and get better nerve pain results. So the culturing medium itself, you buy the medium, like we get ours from the United States, but every lab has kind of their own, it's like baking. Everybody has their own recipe. My family are all bakers from Holland. Their sourdough is a little different than, the next guy's and that. And that's where we're going to see bigger differences. But it's tough too because people don't share that information. It's like, someone figures that out, like they're not going to share that. It's like, come here for those special cells, and it gets limiting. I mean, we treat about 150 people a month, and I really don't want to get larger than that. We're beyond busy with that. But the research needs to get shared because there's plenty of people out there that need help. So it's more of getting it more mainstream and accepted, I think.
Yeah, and just to follow up on that, I mean, you're collecting data, are you sharing your research, and are you doing your own research with your mesenchymal stem cell treatments as you learn over the years?
Yeah, we're doing that. I mean, with the new lab, right now we haven't had to do much of that, but it's actually a requirement here in Mexico. If you have a lab, you have to publish research. So like, we've been renting space with the University of Guadalajara's research lab. They already meet that requirement because that's all they do is research. But now with our own lab on site, we do have to conduct studies and publish what we're doing. So we'll have that going here pretty soon and be able to share some of that. It's just studies take a long time.
Oh yeah,
it's never quick. But there's been some cool ones. Like a guy we worked with in the past is finishing up a study for prematurely born babies. So one of the most common ways that they die, even after they take them and put them to the NICU, is that the pure oxygen they give them to help them breathe and survive can burn their lungs, and that ends up killing them. So what he found is by giving them 1 million stem cells per kilo of body weight via an IV, he can actually regenerate their lungs, because that's the second place the MSCs go, and he's helped countless babies survive that probably wouldn't have. So there's really cool things coming. It's just they sound too good to be true. There's too many things they work for. So I mean, there's over 100,000 studies if you go on Google Scholar. So it's a lot to look at.
Yeah, and we didn't mention that in so much detail, I think, but there is a logical reason why mesenchymal stem cells can do so much. I mean, they are helping to combat inflammation, and they help your immune system to identify different problems, and then the body goes there, as you mentioned before, and do the work. I mean, if you and that brings me to my next question, because if you look at cancer, I mean, if you have a tumor in the body is a problem because the immune system doesn't recognize it anymore as an issue. It just passes. It's like you're driving on the road and you have a tumor on the left, but you can't see it.
It has your HLA markers.
Yeah. No. So, but there has been studies. I read about it in Neil Rawdon's book, that they had injected. There was a mice that had a tumor, and injected mesenchymal stem cells with a lot of vitamin C, and after I don't know how long, it basically disappeared. The tumor was gone. So, and this is an area, of course, that's very interesting. And people, of course, when you hear about mesenchymal stem cells, they think like, maybe we can treat cancer, but as I understand it, you don't do that now. You have to be cancer-free for 5 years. But I think it's interesting because maybe it has a preventive, it can act preventively for cancers. Maybe not everything, but it's very interesting, and it may be something we will see more in the future, treatments for cancer as well.
Yeah, I think on the prevention side, it's the hugest. Dr. Riordan, the guy who founded the clinic in Panama you went to, his book, Stem Cell Therapies, A Rising Tide, talks about it. And look, stem cells seek out inflammation. They guide the repair and regeneration of what's causing that inflammation. So if you can get rid of the inflammation, you should be able to stop it. Look, he patented using high-dose vitamin C as a cancer cure, published it, and they attacked him. He had to sell that company. It's still around. It's in Kansas, the Riordan Clinic, and they do that. But one of the studies they did, he talks about, is in Japan, they put these metal plates in the abdomens of rabbits, and within like a year, it might have been even sooner, like months, they all developed tumors around that metal plate. And they believe it's because the body's reaction to this chronic inflammation, it's like a last-ditch effort to connect, that it mutates. And things don't tend to evolve in biology, they tend to devolve, and it becomes cancer and this issue, and you end up with those tumors. So then they did the same study, but they put holes in the same metal plate. The cells could communicate enough that they never develop tumors. So there's a huge issue with chronic inflammation. If something is in the way of communication for your cells, they tend to do that degeneration and end up as tumors. So by doing stem cells, you theoretically can prevent those sort of cancers.
Yeah, it's fantastic. And another area I find super interesting is how mesenchymal stem cells can regulate the immune system, including the vital T cells. So, and what's more, that mesenchymal stem cells can help the body to get rid of inflammation. And I mean, it sounds like a perfect combination to combat viruses and disease, in general. Yeah, you know about this, but I think it's good for people to understand because there are no known serious side effects with mesenchymal stem cells. So I see no reason why it should not become a preventive measure as well as prioritized way to treat different types of disease. How do you look at this?
I look at it just like that. I mean, we started with preventative medicine, right? We started initially with human growth hormone, which in my opinion is huge for preventative medicine. It gets kind of a bad rap because certain tumors feed off of IGF-1 and it converts to IGF-1 in the liver. But because of the way it works on the mTOR pathway, it speeds up your cell reproduction. So you get better reproduction and faster reproduction of cells, which they're finding with new studies has a huge impact on anti-aging and health. Even regenerates your thymus gland where your T regulatory cells are produced. So huge there. So then we got into stem cells, and it was we weren't sure if it would be a different market, different people, but no, it's the same people. Majority of our patients are people that want to look and feel better, be preventative, get ahead of the curve. And if they have, almost everyone gets joint pain or things eventually, so they'll fix those things with us. But we have tons of patients that will just do IVs as like a general maintenance, maybe once every year or two. We have one lady that she's done the 100 million IV every year for 5 years. She's 62, her husband's 70. They're both super fit. You can see the video on our site, and they did the DNA methylation test. You spit in the tube, they process it, checks your genetics, and on her biological age, she's 62, but epigenetic, she's 27. Her husband never did an IV, only his knees. His came out at like 85, so that convinced him to do the IV, because if we can turn back the clock, even if you don't physically look younger, if we can on a cellular level have you be younger, you should be able to live longer and have fewer complications or risks. So that's how I look at it, and a lot of other people.
Yeah, if you want to say something about MS, because it's also a very interesting area.
Well, look, I'm from Seattle, Sweden, some of the highest rates of MS in the world, unfortunately. Maybe it's mold, maybe it's pine trees, maybe it's something else, the crap weather, I don't know. But there's something weird going on there, right? And we've treated a lot of people with MS. If you catch it earlier, like your friend, the highest chance, right? I've got patients from, Vancouver, Canada, Seattle, different places, Texas, that are in pretty much full remission, right? We'll never call it a cure because we don't know if it could come back or whatnot, but we know that our combo of the IV with the intrathecal, going to the spinal cord fluid to get them to the brain, has worked incredibly well. And we've got a lot of patients that, they don't have symptoms. We have some that saw improvement and have come back and maybe needed more than one treatment. It really depends. I think there's like 3 or 4 different types of MS. You got like primary progressive and some of the others. So it depends there too, but essentially the goal is to reprogram the immune system. It stops attacking the brain and the spinal cord. And we took it a step further, just like with the autistic kids, by going into the spinal cord fluid. But for adults, we don't have to put them under. I've done that treatment twice. And it sounds intimidating, but it's very simple. Tiny needle, 30 gauge, goes in your lower back. You barely feel a thing. And it allows the cells to get up the spinal cord to the brain, heal lesions, heal damage, clear out waste, boost the immune system. And we've got a lot of before and after MRIs showing repair and regeneration of lesions that aren't supposed to heal.
Yeah. And just a few more areas would you like to cover? And the first one is, organ treatments. You already do that, but just for people to understand that this is a very broad area, and you're seeing promising results, everything from, liver and kidneys and so on. Can you tell us a little bit what currently you're doing, and perhaps if you see something interesting coming in the future?
Yeah, so hearts are number one, because when you do an IV, it goes straight to the heart. So Heart failure, consistently getting people out of that. Lung conditions are tougher because we see a lot of like COPD, pulmonary fibrosis, emphysema type issues because it usually happens later in life. So it's a long time accumulation. It can be smoking, chemicals, things. It's a bit more difficult, but we see results there. Then we see kidney issues, a lot of diabetics, and we can help the diabetes too with the same treatment, the IV. And we see stage 1, stage 2 kidney failure, home runs a lot of the time. Stage 3 might take more than one treatment with like a 300 million IV. And then stage 4, we can't help. The kidneys are shrunk too far. It's just, we haven't found it to work there. Then with livers, we see a lot of like fatty liver disease. We see a lot of cirrhosis. And we've seen incredible results where, fortunately, the liver is the only organ that will regenerate itself. So you get that added boost. And, you know, it depends what's causing it. But if it's alcohol related, well, we're hoping that they're going to stop drinking. But we have had patients that didn't and still healed, believe it or not. So it's I kind of joke. I go, if alcohol killed stem cells, we'd probably all be dead. But so they don't seem to kill them, but they don't help you heal either. And those have been the main organ issues. In the future, I'm not sure where it really goes from there. It just seems to work. So, yeah.
Yeah, just as a note on that, I mean, on alcohol, I mean, since they're anti-inflammatory, the mesenchymal stem cells, they are getting occupied with, if you drink alcohol, they will probably get occupied, working with the inflammation on the alcohol. So my suggestion is not to drink alcohol if you're having your stem cell treatment. It's a little bit of waste. It's a little bit of waste, just side note. But anyway, yeah, but okay, so finally, what would you like to see? I mean, it's fantastic. We have the umbilical cord, we have the placenta, it's accessible, you can grow on it, and as you do in labs, and make it accessible and, identify what's the best way to treat people with mesenchymal stem cells. And it's fantastic that you offer that, but we would like, I think we both agree that we want to see this across the world. If we want to change people's ability to heal, we need much more than, just a few labs here and there or, clinics. So is it regulations, do you think? Is it sharing research? Is it, of course, the whole drug company issue and, the power and interest, their vested interest and so on. But that's perhaps beyond our reach. But what would you suggest if you want to start change this,
I don't know. I can only change what I can do. So we're doing it. There's more than enough people. It's more awareness. People need to know it sucks, but in US, Europe, you can't do it. It's not the right way. So you're going to have to look abroad, and that becomes difficult. That becomes tough to know. I think people just need to be more transparent if they're going to do clinics. Like, you go to our website, all the info's there, links to studies, prices, everything's just there. Like, we're not hiding anything. You can see what's going on. There's plenty of people that need help. Where it grows from here, I don't think it's going to get approved anytime soon unless major rules change. And I don't see that happening. The pharmaceutical companies, if you took away even some of their medicines or gave an alternative, like, it'd crush economies. Whole economies are based on pharmaceuticals and food now, and all the pharmaceutical and food companies are linked. It's horrible, but I don't see how you unattach that without destroying whole country economies. So I don't see it happening anytime soon. I think people are waking up. It will happen, but we're not talking soon. It's going to be a long game, and hopefully pioneers like you that were willing to go out of country and do those sort of treatments will tell others, word will spread, and that's all we can do, tell each other. And I think that's the only way to beat the system, and more will pop up. The economy will always fill a need. If there's a need for more clinics, I'm sure more will pop up, or places like mine will expand. It will happen, and that's all we can do.
Yeah, I totally agree, and I think that was a good note to end on. You have testimonials from your patients. I encourage people to check that out. And if you like this, spread it around and spread the word in general about these mesenchymal stem cell treatments. They are real, and you provide a fantastic way to get them. You have experience, and different ways you can use them. So check out your homepage. I'll put a link below. And I look forward to meet you in person and see your clinic, Josh. It's a fantastic place, looks to be a fantastic place in New Mexico. And yeah, thanks you for this conversation. It was really interesting.
Thank you, Johan.
That was all for today, folks. I hope you liked the conversation. I would love to hear what you think about stem cell therapy. Do you have questions or perhaps your own experience? Please share them below and I will try to answer them. And I will share my experience with the stem cell therapy treatment I will get at the Dream Body Clinic in a transparent way. So stay tuned for that. In the next couple of weeks, I'll work on my energy house and I will share the progress as soon as possible. So stick around for that. I hope to see you next time.